Hey everyone, this is Jim Prusak, physical therapist here at the Pain PT, and today we're going to talk about knee imaging findings and the relationship to pain. We've been talking about the other parts of the body and the imaging findings like X-ray, MRI, CT scans, and we're trying to paint a picture that many of these findings are not necessarily pathological and are not necessarily the cause of people's pain, especially when we're talking about chronic pain. And we're trying to normalize these findings as age-related wear and tear and things that happen to people all the time, but they're not necessarily related to pain. So we're going to go over some of the science today that shows exactly that in relation to the knee. So this first study here was done in the New England Journal of Medicine, one of the more prestigious journals out there, in 2008. They took knee MRIs of about 1,000 people between the age of 50 and 90. And what they found were meniscal tears or meniscal destruction in 19% of women aged 50 to 59 and all the way up to 56% in men who are aged 70 to 90. So we can see as the aging process goes on, the percentage of meniscal tears and destruction goes up. The prevalence of a meniscal tear was 63% amongst those with knee pain, aching, and stiffness on most days, but it was also in 60% of the people who didn't have symptoms. So that's an interesting statistic there, because normally you would say, well, that meniscal tear must be causing all that pain, but there were just as many people who had that meniscal tear who didn't have any knee pain, aching, or stiffness. So what's actually causing the pain? And that's the million-dollar question that we need to look deeply into when we're talking and discussing with our patients and getting the whole story. The majority of meniscal tears were found in persons who did not have knee pain, aching, or stiffness. So that was the conclusion of the study, that basically most of these tears were in people who didn't have knee pain, aching, or stiffness. College basketball players, they took knee MRIs of 24 NCAA Division I players. All of these players had zero pain. All of them were asymptomatic, but all of them had at least one structural abnormality. They took these MRIs pre and post season, and as you can see here, there's a tremendous amount of change they found on MRI in the soft tissue, such as the quadriceps tendon, the patellar tendon. Also found changes in the bone marrow and the meniscus and the cartilage. And their conclusion was a high prevalence of abnormal knee MRI findings was observed in asymptomatic young elite athletes. Now, I would say that these findings aren't necessarily abnormal because they're found in a large percentage of people, of these players, yet they don't have any symptoms. So how can we call those findings abnormal? Again, here's another one. NBA players now. They took MRIs of both knees in 20 NBA basketball players. And what they found was that the overall presence of cartilage damage was almost 50%, was found in almost 50% of the players. They also showed an equal to or higher prevalence of meniscal tears, more than previously reported in the literature. And their conclusion was that these athletes perform at the highest demand level, which indicates that the presence of these lesions did not cause symptoms. So again, here we're finding high-level athletes are having structural changes on their MRIs, yet they're not having any pain. So it's really interesting that these people are playing at a high level in a very, very demanding sport with these knee changes, yet they're not experiencing any symptoms. So this study, 2006, looked at osteoarthritis of the knee, such a common finding we see, in over 200 people. Average age was 60. All the participants were questioned about stiffness and pain in the knee that was MRI'd. What they found was this relationship. They found if you had a large joint effusion, which is a lot of swelling, that was associated with pain and stiffness. And if you had a presence of an osteophyte, which is essentially a bone spur, that was also associated with pain. So they were finding some structural changes being associated with pain. However, all other imaging findings, which included cartilage abnormalities, subchondral cysts, bone marrow edema, subluxation of the meniscus, meniscal tears, or Baker's cyst, which is a swelling in the back of the knee, none of these were associated with symptoms. So again, this is another study showing that many structural changes we see are not directly associated with pain and other symptoms in the knee. This last study we're going to talk about is the best one because the systematic review, it came out in 2018, and the great thing about this is it pooled the data from many studies, multiple studies. It looked at the prevalence of knee osteoarthritis, and it pooled 63 studies, over 5,000 knees that were MRI'd, and all these people in the study had zero pain. All of them were asymptomatic. So here's what they found in these people. They found cartilage defects on average in 11% of all people under 40 and in 43% of people over the age of 40. They found meniscal tears in 4% of people under 40 and 19% in all people over 40. If we look at the bone marrow lesions and osteophytes, 18% of people under 40 have these with no pain, and 25% of people over 40 have them with no pain. So their conclusion here was that osteoarthritis features on MRI are common in asymptomatic uninjured knees and are generally associated with age. And this is the point we're trying to make, is that many of these changes are associated with aging. We need to be able to decipher when a physical structural change is causing the pain or it's just an incidental finding. Last thing they mentioned in the study is that since more than 1/3 of the older population will exhibit these knee OA-related features, medical and/or surgical interventions targeting these imaging findings may not alleviate pain in patients with knee symptoms. And this is because it may not be the cause of the pain. If we're dealing with chronic pain, which has gone on for greater than 6 months or for a longer period of time, as you have seen in some of my other videos, many times we need to look towards the brain and the nervous system as being a culprit in pain and not structural changes in the body. I hope this was helpful, shed some light to you about the knee and the findings we're seeing in the science right now. If you have any questions, you can always reach out to me at my contact information you see on the page here. Have a wonderful day.